Hi everyone, and welcome back to the Living Well with Schizophrenia channel. In today's video, we are going to be going over whether or not you might have schizophrenia. There's a good chance you got to this video because you searched for something like, do I have schizophrenia? Or schizophrenia test or something like that. And so we are going to be going over some of the most common symptoms of schizophrenia so that you can kind of be more aware of what it entails. But also, more importantly, we're going to be talking about why it's important to not self-diagnose and how to go about getting a proper diagnosis. My name is Lauren and I make videos about what it's like living with schizoaffective disorder or schizophrenia. If you would like to see more videos like this one, please make sure to subscribe so as not to miss any of our future content. And also, if you would like to help support the creation of future videos like this one, please check out the link to our Patreon page. It's in the description below. Any support is so appreciated. Thank you. All right, so do you have schizophrenia? So if you're watching this video with that question in mind, you're probably a little bit scared about some symptoms that you may be experiencing that maybe you don't fully understand. And I understand what that feels like. It's scary to be experiencing things that you don't really fully understand and you're not really sure why they're happening. A really common question or message that we get often on this channel is people listing out symptoms that they're experiencing and then wanting us to diagnose them. We are not medical professionals, so this is not something that we are at all comfortable with doing, but it's a really common thing that people come to us with. And so we wanted to kind of address that through this video. So in this video, we're going to be going over why it's so important to get a diagnosis from a mental health professional and why self-diagnosis is a very, very bad thing. Also, we are going to be going over some of the common symptoms of schizophrenia to maybe give you a better grasp on what some of the diagnostic criteria is so that you can bring that information to a mental health care professional, such as a psychiatrist, to get a proper diagnosis. All right, so first off, why should you not be self-diagnosing yourself? So, for starters, you're not a medical professional, so you don't have all of the knowledge that a psychiatrist would have in terms of putting together a diagnosis for yourself. It's also a very stressful thing, and if you are trying to self-diagnose yourself, you're going to be really stressed out and potentially unnecessarily if it's not the proper diagnosis. Also, people who are going through symptoms of schizophrenia don't always have the best insight into their illness. And, that applies for other mental illnesses too. It's hard to have really good insight into your mental illness while you're experiencing symptoms, and especially while you're experiencing symptoms for the first time. And so it's going to be really helpful to have that third-party professional who can kind of observe and take in what you're giving, the information that you're giving them to better put together a proper diagnosis. It's also really common that, people don't really fully understand what mental illnesses like schizophrenia entail or really are. And so sometimes, it's very easy for an individual who's seeking out information to self-diagnose themselves to kind of cherry pick information based on whether they want to be diagnosed with schizophrenia or maybe don't want to be diagnosed with schizophrenia, and to kind of cherry pick information that leads to the end result that they are looking for. I completely understand the desire to want to put a label on the things that you're experiencing because it makes it a little bit more digestible and a little bit easier to understand, but it's so important that that label or that diagnosis is coming from an informed mental health professional and not from yourself. Because, another reason for this is that if you self-diagnose, you're not really left with any options for treatment. You're just kind of left there sitting like, okay, I have schizophrenia, now what? So if that diagnosis is coming from a mental health professional, they're going to be able to help you create a treatment plan, and they're going to be able to help connect you with other resources such as therapy or medication or whatever other social supports or medical supports you may need. And so it's really, really important to get that diagnosis from a medical professional. I cannot stress that enough. And it's important to note that proper diagnosis is even difficult for medical professionals to do or to give to a patient. It takes a lot of time to work together with your medical professional to come to a accurate, proper diagnosis. There's a lot of factors at play, and they need to observe you over a period of time, and they need to take in a lot of information in order to make an accurate diagnosis. And so it can take a long time, and it can be a bit of a long, tedious process, but it's so important to really work together with your medical professional, your psychiatrist or your doctor, to come to a place that feels good for you, where you feel that the diagnosis that they're giving you accurately, explains the symptoms that you're experiencing, and you both can agree on what feels best. moving forward. All right, so self-diagnosis is bad. Do not do it. Okay, so moving on, we are going to discuss the main symptoms of schizophrenia, which you can compare to your own experience and then bring that to your doctor. It is important to note first off, though, that if you aren't experiencing all of the symptoms or any of the symptoms that I go over in this video, you may still be struggling with a different kind of mental illness. And so if you have any concerns at all, it's really important to bring these concerns to a doctor who is going to be better able to take in the information you're giving them and your concerns that you're presenting them with to either diagnose you or help you out in some other way. All right, so what I'm going to be using to go over the main diagnostic criteria for schizophrenia is the DSM-5, the Diagnostic and Statistical Manual of Mental Disorders. This is what's used in North America. However, if you are in Europe or I think Australia as well, they use something called the ICD-10, which I believe stands for the International Classification of Diseases. It's basically the same thing, same information really. It's just different parts of the world use either the DSM-5 or the ICD-10. Okay, so the first diagnostic criteria in the DSM is that you have to be experiencing 2 or more of the following, each present for a significant portion of time during a 1-month period or less if successfully treated. Delusions, hallucinations, disorganized speech, example, frequent derailment or incoherence, grossly disorganized or catatonic behavior, and negative symptoms. And at least one of these must be one of the first 3, which were delusions, hallucinations, or disorganized speech. So I'm going to talk a little bit about each one of these. So starting with the first one on this list, delusions. So delusions are essentially a false belief based on something that does not really fall within reality. And so delusions can be, so for me, delusions often revolve around thinking that the medical professional is, trying to harm me, or that medications are poisonous, or that helicopters or the police are out to get me. So there's a lot of those kind of persecutory delusions for me, but there are different kinds of delusions as well that people can experience. So it can be even something like, I believe that there is a giant weather machine in the sky that is dictating weather, or any sort of false belief. There can be a delusion. The second one is hallucinations. Now, hallucinations are kind of a hallmark symptom of schizophrenia, and you don't need to have hallucinations based on this DSM criteria to have schizophrenia, but it's very rare that hallucinations are not present. And so hallucinations are the experience of some sort of stimuli that isn't really there, and they can fall within any of the 5 senses. So visual, audio, olfactory, so smell, touch, so tactile, and also taste. So any of those 5 senses you can experience a hallucination within those. So for me personally, when I was first experiencing symptoms, it began with olfactory hallucinations, and I would smell these really awful smells that I couldn't really identify and I couldn't really locate the source of. And I would check in with people around me to see if they could smell it too. And well, most of the time, all of the time, they were like, no, I don't smell anything. And so I knew that those were not really happening. It took a while for me to understand that I was hallucinating with those. It just seemed like something's misfiring in my brain, or I smell something that other people don't smell, or that kind of thing. So that was a hard one to wrap my mind around, understanding that it wasn't real. My hallucinations then began to take the form of audio hallucinations. So I would hear my name spoken aloud when I was completely alone. And that was how it started. And then it gradually grew to be more of the conversational dialogue that I was hearing. And as I fell deeper into psychosis, it became command hallucinations and that kind of thing that I was experiencing. And so I think that the primary ones that people often experience, anecdotally anyway, are visual hallucinations and audio hallucinations. I don't know, I've met a lot of people who also have olfactory hallucinations or tactile hallucinations, but I think the staple ones, the main ones, are kind of audio and visual. Number 3 is disorganized speech. Example, frequent derailment or incoherence. And so this is kind of like there's a concept called word salad, where people with schizophrenia jumble up a lot of different words because they can't quite keep the same train of thought, or, it comes out as not what they're meaning to communicate. And so it comes out as a bit of a word salad where it's just random words that don't really make sense together, that might make sense to how they're communicating, or it might not make sense to how they're communicating if they're really disorganized, if they have really disorganized thought as well. But disorganized speech is kind of one of those observable symptoms that are used for diagnosis. So me personally, I don't often present with disorganized speech because when I'm experiencing this symptom, I tend to just stop talking because I'm very, very self-conscious of this symptom. And I know when it's happening for me. I know when I am going to speak and it's not really going to make the most sense if I'm actually verbally communicating with someone. And so what usually happens when I know I'm experiencing this is I just stop talking because I'm afraid that what I'm saying is not going to make sense. And so I don't know if that's kind of something that a lot of other people experience, where they just stop communicating because they're afraid that disorganized speech is going to come out. But that's the way it is for me. All right, so those first three, so delusions, hallucinations, and disorganized speech, there needs to be one of those present to diagnose schizophrenia. Now, these other two can also be present, so you need 2 or more of the total 5 to be diagnosed with schizophrenia. And so the fourth one is grossly disorganized or catatonic behavior. And so, grossly disorganized behavior would be, behaviors that just aren't really making sense, or not really being able to properly function within the world. Catatonic behavior is when someone just stops expressing or emoting at all, and they are just kind of rigid and do not speak, do not move, do not show emotion or anything, and just very catatonic. And the fifth and last symptom that can be present for a diagnosis of schizophrenia is negative symptoms. Now, we've done a video on positive and negative symptoms, which you can check out if you want more information on what exactly negative symptoms are. But basically, they are diminished emotional expression or avolition. And so this basically just means that there is a lack of some sort of behavior, a lack of emotion, or a lack of avolition to do something, a lack of motivation to do something. So negative symptoms are kind of the removal of a behavior. So it often looks a lot like depression, which is kind of where things started out with me. I think I was experiencing a lot of negative symptoms in the beginning part of my mental health journey, and it was mistaken for depression. And so, that's just another reason why it's very important to tell your doctor everything and to really work together to communicate all of the symptoms that you're experiencing, and, trying to be aware of all of these different criteria for schizophrenia or not. If you may not have schizophrenia, you may be dealing with some other mental illness. And so it's really important to try to be as self-aware as possible, to understand how to communicate your symptoms or your concerns with your doctor. And something that's really helpful for this, I've found anyway, is to keep kind of a journal of things that you notice that are a little bit off or that you're concerned about, and to write those things down to get a better sense or sort of documentation of what you're experiencing day to day. Because, it's hard sometimes to go into a doctor's office and remember everything that's been going on over the last month or however long it's been since you've seen them last. That's a hard thing to do, especially when it's kind of vulnerable information like symptoms that you're experiencing mental health wise. And so if you have, written documentation of all of the concerns that you have had over the last month, it can be a lot easier to present your doctor with that. And they are also grateful to have a more detailed list of what concerns you've been dealing with. All right, to sum up that list of the diagnostic criteria of schizophrenia, you need to have 2 or more of the total 5, the whole list, each present for a significant portion of time during a 1-month period or less if successfully treated, and at least one of these must be delusions, hallucinations, disorganized speech, and then the other 2 are grossly disorganized or catatonic behavior and negative symptoms. So if you're concerned about any of those, definitely take that information to your doctor. Now, this is the diagnostic criteria for schizophrenia. So this is what doctors are looking for in order to provide a diagnosis of schizophrenia. There are also other symptoms, such as cognitive symptoms, which we've done a video about as well, if you want to check out that one to learn more about what that is. But that can also be something that you're dealing with, where, there's cognitive impairment in terms of your ability to retain information or to think critically about information or to act based on information you've received. Cognitive symptoms can also be present with schizophrenia, but they're not necessarily a diagnostic criteria for it. Okay, so what do you do if you suspect that you might have schizophrenia? If you've listened to these diagnostic criteria and you're like, yeah, that sounds like what I'm experiencing. So the very first thing you need to do is make an appointment with your doctor or your psychiatrist. They are going to be able to best help you understand what the symptoms that you're experiencing maybe might mean or might be alluding to, and they will be able to properly give you a diagnosis if there is enough information present to make that diagnosis. Or they might ask you more questions about more information that they might need in order to get to a diagnosis, or they might just help you with the symptoms that you're experiencing if they don't necessarily meet the diagnostic criteria for schizophrenia or for any other mental illnesses. But they will still be able to help you address the symptoms that you are experiencing and find adequate or effective treatment for those symptoms. Now, the earlier you can get to your doctor, the better. There has been a lot of studies done on the effectiveness and the importance of early intervention when it comes to psychotic disorders such as schizophrenia. There's a lot of clinics out there that are titled early psychosis intervention clinics, because that is a very, very important piece of treatment for psychotic illnesses such as schizophrenia. The earlier you can intervene in the symptoms flaring up and, falling into psychosis, the more effective treatment is going to be and the better chances of recovery there will be. It's kind of important to note that the more severe your episodes are and the more frequent your episodes are, the less ideal your prognosis, your long-term prognosis is going to be. The more often you fall into psychosis and the deeper you fall into psychosis, the worse it's going to get. And so if you can try to limit the frequency of your psychotic episodes and the intensity of your psychotic episodes, you're going to have a better prognosis moving forward. And another thing that I just want to touch briefly on is anosognosia. Now, we've done a video on this as well, so that you can check out if you want to learn more about what anosognosia is. But basically, it's a lack of insight or a lack of awareness of your illness. And so this might be something that you're experiencing as well. So you may hear this list of symptoms and be like, yeah, that sounds like what I'm experiencing, but somehow convince yourself that it's not a problem. And this is kind of a symptom of anosognosia. And so, if you are relating to any of these symptoms, or if you have any concerns at all about any sort of symptoms, mental health wise or otherwise, please go talk to your doctor. They're not going to immediately throw you into the hospital and lock you up. They're not going to immediately over-medicate you. They're not going to, take away your autonomy, your self-autonomy or anything. They're really only there to help you address the symptoms that you're experiencing and the concerns that you're presenting with. So, the more open and honest dialogue you can have with your doctor, the better it's going to be long-term for you, because you're going to be able to, together with your doctor, address the symptoms, the distressing symptoms that you are experiencing. All right, so we titled this video, Do You Have Schizophrenia? And, we wanted to provide some guidance about the diagnostic criteria for whether or not you do have schizophrenia. But most importantly, what I want you to take away from this video is the importance of going to see a doctor if you have any concerns at all. We really hope that if you search, do I have schizophrenia, or something like along those lines that led you to this video, we hope that your search for information about whether or not you have schizophrenia stops here, because we really want to encourage you to collect as much information as you can in order to better be able to talk to your doctor about what you're experiencing. But we really want to encourage you to make that step to talk to a doctor about what you are experiencing. It is really critical to understand the dangers of self-diagnosing. And so again, we just really want to encourage you to seek out professional medical help from a doctor or a psychiatrist, preferably a psychiatrist if it's for mental health, to better be able to address the symptoms and concerns that you're experiencing and to be able to provide a diagnosis if appropriate. Okay, so thank you so much for watching this video. If you found it helpful at all, please make sure to give us a thumbs up and comment if you have any other tips for how to talk to your doctor about receiving a diagnosis, or how to, communicate with your doctor in order to get the best fitting or most appropriate diagnosis possible. Also, if you want to hear more about what my own personal experience was like getting a diagnosis, you can check out the video here, my experience with schizophrenia/schizoaffective disorder, where I go over what my experience was like, what my early symptoms were like, getting a diagnosis and living with the diagnosis, what that experience was like for me. So thank you so much again for watching, and as always, wishing you and your loved ones good health. See you in the next video. Bye.